Scars is a concern for many, troubling you, affecting your confidence, etc. Worry no more, there are multiple modalities of treatment for scars. Scars can be caused by acne, chickenpox, some trauma, minor accidents, etc. So when it happens on the face and if it affects your confidence, consult your dermatologist to understand what can be done and how it is done. Most of the modalities available to treat scars require multiple settings, but over a period of 4 months to 6 months, your scars can be reduced up to 50% or even up to 70%. Basically, it has age-old methods like derma rollers. Well, this was my only tool to treat scars when I was doing my post-graduation way back in 2003. So we used to apply an anesthetic cream, wait for around 45 minutes to numb the skin and then roll this on your skin. What happens is the fibrous bands which is actually causing these scars are broken and new collagen is synthesized, thereby uplifting the scars. The margin of the scars will remain the same, but the depth of the scars is constantly reduced. The same technology in better advanced options are available. CO2 fraction laser is one such. The advantage of CO2 fraction laser, in addition to it being much better technologically advanced, is that it can be used even to treat the tiniest of the scars because the depth as well as the size which we are treating can be adjusted. So even if you have a teeny tiny scars on the tip of your nose, it can be treated very well with CO2 fraction laser. There is an additional tool which I use called microneedle fractional radiofrequency. It's in fact a combination of two technology called microneedling and radiofrequency. Here, multiple needles are penetrated into your skin and through these needles, some RF waves are passed which actually tighten your skin as well as improve your scars. It's an excellent technology to treat if you have in addition to scars some amount of skin sagging and dilated pores. So if you're about 25 and you have sagging skin, slight dilated pores, plus acne scars or chickenpox scars, my tool to go is microneedle fractional radiofrequency. Most of my patients will decide the treatment option available to them after I explain the pros and cons of each. Well, if you are somebody who does not want any downtime and wants a treatment which will not show anything other than maybe a mild redness for a day or two, derma roller is option. But if you do not mind even around 4 to 5 days of downtime wherein your skin is slightly pigmented or blackish and then it heals over a period of 4 to 5 days leaving behind the normal skin, then fractional laser is the best option. It is what is called the gold standard for treating acne scars because the results are phenomenal. Ideally, most of my patients undergo a combination of all the treatments. After doing MNFR or fractional laser, sometimes even derma roller, if you want a finer finish, then the product to go to is filler. Filler basically is hyaluronic acid, and when I put filler under your scars, under the deep layers of skin, it lifts up the scars. The only disadvantage being it is temporary and you will have to redo it maybe after a year or year and a half. To know more, contact us.